I think this is really interesting. I'm also a movement disorder specialist, and so I am familiar with focused ultrasound from that standpoint because it's oftentimes used to treat essential tremor, and even now looking at Parkinson's disease. But there has been some evidence over the past couple of decades that focused ultrasound may be able to, or actually can, transiently open up the blood-brain barrier. So it increases the permeability of the blood-brain barrier. And so when we hear about that, I think most everybody's mind goes to, oh, well, now we can penetrate this barrier with drugs, because up to this point, we know that we were created to have this blood-brain barrier that can protect us. I mean, there's a very important reason for the blood-brain barrier. However, it's the bane of existence for pharmaceutical companies that are trying to get targeted therapies within the brain. So I think everyone's mind immediately went to, can we use this tool to help get drugs past the blood-brain barrier? So can we get chemotherapy agents into, brain cancers? And that's been shown to be the case. And in the case of Alzheimer's disease, can we use this technology to get, say, some of these monoclonal antibodies into the brain? And even in some animal models, there was one in particular that looked at aducanumab, where administering focused ultrasound was able to increase the sort of concentration of aducanumab that made it into the brain. But what's interesting, if that's not interesting enough, what's even more interesting is that there does seem to be potentially some effect of the focused ultrasound itself on the pathology. Now, we're in very early days here, so this is a little bit of hand waving, but what it appears to be doing, well, I guess I should back up and say there've been a few trials. One that I highlighted was looking at long-term safety outcomes and imaging changes and cognitive changes in about 10 patients that underwent focused ultrasound. These were patients that were clinically diagnosed with mild Alzheimer's disease. And so essentially the high points from the study were that, one, they were able to do this safely. I think they had one patient who had some edema in the hippocampus, but that resolved within 3 days. They showed that it was that the blood-brain barrier opening, as evidenced by contrasted MRIs, that was limited to just the areas that were targeted, just the brain areas that were targeted. So that's very important. Another is that it was transient. So the blood-brain barrier opened and it closed within 24 to 48 hours, which is, of course, what we want. We want to be able to reestablish the integrity of the blood-brain barrier. And then there were some interesting things. Now, it's a very small study, so it's not really powered for clinical significance, or for statistical significance, but there was some evidence on changes in the MMSE scores that there may be a cognitive benefit of this. And so, that has everyone scratching their heads on, well, why would that be? These patients also had amyloid PET scans, and so it did look like there was a subtle decline in amyloid on their PET scans. Hard to know what to make of that, but taking that with some animal models, it does seem that that applying fuzz may reduce amyloid, may also affect neurogenesis as well. So the jury is very much still out. It's very early days with this, but this could potentially be another treatment modality that may be something that could be used by itself or in conjunction with some of these other therapies we've talked about.